Hello everyone, and welcome back. Today we are going to talk about a very common medication class in nursing pharmacology, NSAIDs. NSAIDs stands for non-steroidal anti-inflammatory drugs. The three medications we are focusing on today are ibuprofen, naproxen, and ketorolac. You may know ibuprofen by brand names like Advil or Motrin. You may know naproxen by the brand name Aleve, and ketorolac is often known by the brand name Toradol. These medications are very common, but they are also very testable in nursing school because they have important safety concerns. NSAIDs can be helpful for pain, fever, and inflammation, but they can also cause problems like stomach bleeding, kidney injury, increased blood pressure, fluid retention, and increased risk of heart attack or stroke. So in this video, we are going to break NSAIDs down step by step. We will talk about why they are used, how they work, side effects, black box warnings, nursing responsibilities, labs to monitor, patient teaching, and what findings should be reported to the provider. And throughout the video, I will add pop test questions to help you think like a nurse. Let's start with the basics. NSAIDs are non-steroidal anti-inflammatory drugs. Let's break that word down. Non-steroidal means they are not steroids. Anti-inflammatory means they reduce inflammation. So NSAIDs help with pain, fever, and inflammation. That is what makes them different from acetaminophen, also known as Tylenol. Acetaminophen helps with pain and fever, but it does not really reduce inflammation. NSAIDs help with pain, fever, and inflammation. That is one of the biggest differences to remember. A simple memory tip is, NSAIDs calm the flame. The flame is inflammation. When tissue is inflamed, it may be swollen, red, warm, and painful. NSAIDs help calm that inflammatory response. Common reasons patients take NSAIDs include headaches, dental pain, muscle aches, menstrual cramps, arthritis pain, back pain, sprains, post-operative pain, and fever. For example, a patient with menstrual cramps may take ibuprofen. A patient with arthritis may take naproxen. A patient in the emergency department with severe kidney stone pain or post-operative pain may receive ketorolac. But even though these medications are common, they are not risk-free. Pop test question. Which statement best describes NSAIDs? A. They only reduce fever. B. They reduce pain, fever, and inflammation. C. They are opioids. D. They are antibiotics. The correct answer is B. NSAIDs reduce pain, fever, and inflammation. Now let's talk about how NSAIDs work. NSAIDs work by blocking enzymes called COX enzymes. COX stands for cyclooxygenase. There are two main types you should know for nursing pharmacology, COX-1 and COX-2. COX enzymes help make substances called prostaglandins. Prostaglandins are chemical messengers in the body. They are involved in pain, fever, and inflammation. So when NSAIDs block COX enzymes, they decrease prostaglandins. Less prostaglandin means less pain, less fever, and less inflammation. That is the helpful part. But prostaglandins also have protective jobs in the body. They help protect the stomach lining. They help maintain blood flow to the kidneys. They also play a role in platelet function and blood clotting. So when NSAIDs lower prostaglandins, we get the benefits, but we can also get side effects. This is the key concept. NSAIDs decrease prostaglandins. That reduces pain and inflammation, but it can also reduce stomach protection, reduce kidney blood flow, and increase bleeding risk. Memory tip. Prostaglandins protect. Prostaglandins protect the stomach and help support kidney blood flow. So when NSAIDs block prostaglandins, you should think stomach, kidneys, bleeding, and heart. Pop test question. NSAIDs relieve pain and inflammation mainly by blocking what? A. Insulin. B. COX enzymes and prostaglandin production. C. Acetylcholine receptors. D. Dopamine receptors. The correct answer is B. NSAIDs block COX enzymes, which decreases prostaglandins. Now let's compare ibuprofen, naproxen, and ketorolac. Ibuprofen is one of the most common NSAIDs. It is used for mild to moderate pain, fever, inflammation, headaches, menstrual cramps, muscle aches, and arthritis symptoms. Ibuprofen is available over the counter and by prescription. Naproxen is also an NSAID. It is often used for pain, inflammation, arthritis, menstrual cramps, and muscle aches. A key difference is that naproxen usually lasts longer than ibuprofen. That means it is often taken less often. For example, ibuprofen may be taken every 6 to 8 hours depending on the order, while naproxen may be taken every 8 to 12 hours depending on the order. Now, ketorolac is different. Ketorolac, or Toradol, is a stronger NSAID used for short-term moderate to severe pain. You may see ketorolac ordered after surgery in the emergency department or for acute pain. It can be given IV, IM, or orally, depending on the situation and facility policy. But ketorolac is not for long-term use. This is a major nursing school point. Ketorolac use should not exceed 5 days total in adults. That includes combined use from IV, IM, and oral forms. So if a patient receives IV ketorolac in the hospital and then oral ketorolac after, the total combined duration should still not go over 5 days. Why? Because the risk of serious side effects goes up, especially gastrointestinal bleeding, kidney problems, and bleeding risk. Memory tip: ketorolac is quick, strong, and short. Quick, strong, and short-term. Pop test question: which NSAID is limited to short-term use, usually not more than 5 days total? A. Ibuprofen. B. Naproxen. C. Ketorolac. D. Acetaminophen. The correct answer is C. Ketorolac is used short-term and should not exceed 5 days total in adults. Now let's talk about why NSAIDs are used. NSAIDs are used when the patient has pain related to inflammation. For example, arthritis pain is often inflammatory. A sprained ankle may be painful because tissue is swollen and inflamed. Menstrual cramps involve prostaglandins, which is why NSAIDs can work well for cramping. Dental pain may involve inflammation. Back pain may involve muscle or joint inflammation. NSAIDs are also used for fever. They help lower fever by affecting prostaglandins involved in the body's temperature control. So for fever, NSAIDs can be an option, although acetaminophen is also commonly used. Here is a clinical example. A patient comes to the clinic with knee pain from osteoarthritis. The knee is stiff and painful. The provider recommends naproxen as needed, along with non-medication strategies like rest, physical therapy, ice or heat, and weight management if appropriate. In this case, naproxen may help because the pain has an inflammatory component. Another example: a post-op patient has moderate pain. The provider orders ketorolac IV every 6 hours for a short period. The goal is to manage pain while possibly reducing the amount of opioid medication needed. This is called multimodal pain management. Multimodal pain management means using more than one type of pain control strategy. For example, acetaminophen, NSAIDs, ice, positioning, and opioids for breakthrough pain may all be part of the plan. But remember, NSAIDs are not safe for every patient. Now let's talk about side effects. This is one of the most important parts of NSAIDs. The common side effects include upset stomach, nausea, heartburn, abdominal discomfort, dizziness, and sometimes headache. But the serious side effects are what nursing students really need to remember. The big serious risks are gastrointestinal bleeding, kidney injury, cardiovascular events, fluid retention, increased blood pressure, and bleeding risk. Let's start with the stomach. NSAIDs can irritate the stomach and increase the risk of ulcers and bleeding. This happens because prostaglandins normally help protect the stomach lining. When NSAIDs decrease prostaglandins, the stomach lining has less protection. That can lead to gastritis, ulcers, bleeding, or even perforation. Perforation means a hole forms in the stomach or intestine. That is an emergency. Signs of GI bleeding include black tarry stools, bright red blood in stool, vomiting blood, coffee ground emesis, severe stomach pain, weakness, dizziness, low blood pressure, or a drop in hemoglobin and hematocrit. Coffee ground emesis looks like vomit with dark coffee grounds in it. That can indicate old blood. Memory tip: NSAIDs can make the stomach sad. Stomach pain, ulcers, and bleeding. Pop test question: a patient taking naproxen reports black tarry stools. What should the nurse do? A. Document it as normal. B. Tell the patient to take another dose. C. Report it to the provider. D. Tell the patient to take it with orange juice only. The correct answer is C. Black, tarry stools may indicate gastrointestinal bleeding and should be reported. Now let's talk about kidneys. NSAIDs can reduce blood flow to the kidneys. Remember, prostaglandins help maintain kidney blood flow, especially when the kidneys are under stress. If NSAIDs decrease prostaglandins, kidney perfusion may decrease. This can lead to acute kidney injury, especially in patients who are dehydrated, older adults, patients with chronic kidney disease, patients with heart failure, or patients taking certain medications like ACE inhibitors, ARBs, or diuretics. This is sometimes called the triple whammy, when a patient is taking an NSAID plus an ACE inhibitor, or ARB plus a diuretic. Why does that matter? Because all three together can increase the risk of kidney injury. For example, a patient takes lisinopril, hydrochlorothiazide, and then starts taking ibuprofen every day for back pain. That patient may be at higher risk for kidney problems. Nursing labs to monitor include BUN, creatinine, and estimated glomerular filtration rate, also called eGFR. Also monitor urine output. A decrease in urine output can be a warning sign. Pop test question. Which lab is most important to monitor for kidney function in a patient receiving NSAIDs? A. Creatinine. B. Hemoglobin A1c. C. Troponin. D. Amylase. The correct answer is A. Creatinine helps evaluate kidney function. Now let's talk about cardiovascular risks. NSAIDs can increase the risk of heart attack and stroke. This risk may be higher in patients who already have heart disease or risk factors for heart disease, but it can also occur in patients without known heart disease. The risk can increase with higher doses and longer use. NSAIDs can also increase blood pressure and cause fluid retention. Fluid retention means the body holds on to extra fluid. This can worsen heart failure. So for patients with heart failure, hypertension, kidney disease, or a history of heart attack or stroke, NSAIDs require caution. For example, if a patient with congestive heart failure starts taking ibuprofen daily, they may notice swelling in the legs, shortness of breath, or sudden weight gain. Those are warning signs. Nurses should monitor blood pressure, edema, daily weight if ordered, lung sounds, and symptoms like chest pain or shortness of breath. Pop test question. Which patient should the nurse be most concerned about taking NSAIDs regularly? A. A healthy young adult taking 1 dose for a headache. B. A patient with heart failure and chronic kidney disease. C. A patient with seasonal allergies only. D. A patient with mild dry skin. The correct answer is B. Heart failure and chronic kidney disease increase the risk of NSAID complications. Now let's talk about bleeding risk. NSAIDs can increase bleeding risk because they affect platelet function. Platelets help the blood clot. Aspirin has the strongest antiplatelet effect, but other NSAIDs can still increase bleeding risk. This matters especially for patients who are taking anticoagulants or antiplatelet medications. Examples include warfarin, heparin, enoxaparin, apixaban, rivaroxaban, clopidogrel, and aspirin. If a patient is taking an NSAID plus a blood thinner, their risk of bleeding may be higher. Signs of bleeding include easy bruising, bleeding gums, nosebleeds, blood in urine, black stools, vomiting blood, unusual weakness, dizziness, or a drop in hemoglobin. Ketorolac is especially important here because it has a higher bleeding risk and is contraindicated in certain bleeding situations. For example, ketorolac should not be used around certain surgeries with high bleeding risk and should not be used in patients with active bleeding. Pop test question. A patient taking warfarin asks if they can take ibuprofen for pain. What is the best response? A. Yes, it is always safe. B. Take double the dose. C. You should check with your provider because NSAIDs can increase bleeding risk. D. Ibuprofen is an antibiotic. The correct answer is C. NSAIDs can increase bleeding risk, especially when combined with anticoagulants. Now let's talk about black box warnings and major warnings. NSAIDs have serious warnings for cardiovascular and gastrointestinal risks. Cardiovascular risk means increased risk of serious events like heart attack and stroke. These events can occur without warning and may be fatal. The risk may increase with longer use, higher doses, and in patients with cardiovascular disease or risk factors. NSAIDs are also generally avoided around coronary artery bypass graft surgery, also called CABG. Now, GI risk means serious stomach or intestinal bleeding, ulcers, or perforation. These can also occur without warning and may be fatal. Older adults and patients with a history of ulcers or GI bleeding are at higher risk. Ketorolac has very important boxed warnings. Ketorolac is only for short-term management of moderate to severe acute pain. It is not for minor or chronic pain. The total duration of ketorolac therapy should not exceed 5 days in adults. Ketorolac also has warnings related to GI bleeding, kidney risk, bleeding risk, and hypersensitivity reactions. So when you see ketorolac on a nursing exam, think strong NSAID, short-term only, watch GI bleeding, kidneys, and bleeding risk. Memory tip: Toradol has a timer. Ketorolac or Toradol has a 5-day timer. Pop test question: why is ketorolac not used long-term? A. It stops working after 1 dose. B. It has increased risk of serious side effects like GI bleeding and kidney injury. C. It is an opioid. D. It causes hypoglycemia. The correct answer is B. Ketorolac has significant risk for serious side effects and is limited to short-term use. Now let's talk about contraindications and precautions. NSAIDs should be avoided or used with extreme caution in certain patients. These include patients with active GI bleeding, history of serious ulcer disease, severe kidney disease, severe heart failure, allergy to NSAIDs, aspirin-sensitive asthma, bleeding disorders, and patients undergoing or recovering from certain surgeries. They should also be used cautiously in older adults. Older adults have a higher risk of GI bleeding, kidney injury, and cardiovascular complications. Patients who drink alcohol heavily are also at increased risk of stomach bleeding. NSAIDs can worsen stomach irritation, and alcohol can also irritate the stomach. Together the risk goes up. NSAIDs should also be used cautiously during pregnancy, especially later pregnancy. Patients who are pregnant should always check with their provider before using NSAIDs. Nurses should also ask about asthma. Some patients have aspirin-sensitive asthma or NSAID-exacerbated respiratory disease. That means NSAIDs can trigger bronchospasm or breathing problems. If a patient says, "I took aspirin once and my throat got tight," or "ibuprofen makes me wheeze," that is important. Do not ignore it. Pop test question: which patient history is most concerning before giving ibuprofen? A. I had wheezing and trouble breathing after taking aspirin. B. I once had a mild headache. C. I wear glasses. D. I drink water every day. The correct answer is A. A history of breathing problems with aspirin or NSAIDs may indicate a serious sensitivity. Now let's discuss nursing responsibilities before giving NSAIDs. First, assess the reason for the medication. Is the patient having pain, inflammation, fever? If it is for pain, assess the pain level, location, quality, duration, and what makes it better or worse. If it is for fever, assess temperature and signs of infection. Next, check allergies. Ask specifically about allergies or reactions to aspirin, ibuprofen, naproxen, ketorolac, or other NSAIDs. Next, review the patient's medical history. Look for kidney disease, GI ulcers, GI bleeding, heart failure, hypertension, heart attack, stroke, asthma triggered by NSAIDs, bleeding disorders, or liver disease. Next, review the medication list. This is very important. Check for anticoagulants, antiplatelets, corticosteroids, SSRIs, ACE inhibitors, ARBs, diuretics, lithium, and other NSAIDs. Why corticosteroids? Because corticosteroids like prednisone can also increase GI bleeding risk when combined with NSAIDs. Why SSRIs? Some antidepressants can increase bleeding risk, and when combined with NSAIDs, GI bleeding risk may increase. Why ACE inhibitors, ARBs, and diuretics? Because of kidney risk. Next, check labs. Important labs may include BUN, creatinine, eGFR, hemoglobin, hematocrit, platelets, and sometimes liver enzymes depending on the patient. If the patient is on warfarin, INR is important. Next, check vital signs. Pay attention to blood pressure. NSAIDs can raise blood pressure or worsen fluid retention. Also check for edema, shortness of breath, and weight gain in patients with heart failure. Finally, for ketorolac, check how long the patient has been receiving it. Remember, ketorolac should not exceed 5 days total in adults. Pop test question: before giving ketorolac, what should the nurse check? A. Whether the patient has received ketorolac for several days already. B. The patient's favorite food. C. The patient's shoe size. D. Whether the patient likes coffee. The correct answer is A. Ketorolac has a strict short-term use limit, so duration matters. Now let's talk about lab monitoring. For kidney function, monitor BUN, creatinine, and eGFR. Creatinine is especially important because it helps show how well the kidneys are filtering. If creatinine rises, kidney function may be worsening. Monitor urine output in hospitalized patients, especially if they are acutely ill. A drop in urine output can be a warning sign. For bleeding, monitor hemoglobin and hematocrit. If hemoglobin and hematocrit drop, think bleeding. Also monitor platelets if bleeding risk is a concern. For patients on warfarin, monitor INR. For patients with heart failure or fluid issues, monitor weight, edema, lung sounds, blood pressure, and intake and output. Some patients may also need liver function tests, although kidney and GI monitoring are usually more emphasized with NSAIDs. Pop test question. A patient on NSAIDs has a rising creatinine and decreased urine output. What should the nurse suspect? A. Possible kidney injury. B. Improved kidney function. C. Normal expected finding. D. Low blood sugar. The correct answer is A. NSAIDs can reduce kidney blood flow and may contribute to kidney injury. Now let's talk about administration tips. NSAIDs are often taken with food or milk to reduce stomach upset. Taking NSAIDs with food does not completely prevent ulcers or bleeding, but it may help with stomach irritation. Encourage patients to take the medication exactly as directed. They should not take more than the recommended dose. They should not combine multiple NSAIDs unless the provider specifically tells them to. For example, they should not take ibuprofen and naproxen together. They should not take ketorolac with ibuprofen or naproxen. Combining NSAIDs increases the risk of side effects without usually giving much extra benefit. Also, patients should not assume over-the-counter means completely safe. Ibuprofen and naproxen are available over the counter, but they can still cause serious harm if used incorrectly. For IV ketorolac, follow facility policy for administration, dilution if required, IV push timing, and monitoring. For IM ketorolac, use proper injection technique and monitor for injection site discomfort. For oral ketorolac, remember that it is usually used as continuation therapy after IV or IM ketorolac, and the total therapy duration still cannot exceed 5 days. Pop test question. A patient asks, "Can I take naproxen and ibuprofen together for stronger pain relief?" What is the best response? A. Yes, combining NSAIDs is always safer. B. No, you should not combine NSAIDs unless your provider tells you to. C. Yes, but only with grapefruit juice. D. Naproxen is not an NSAID. The correct answer is B. Combining NSAIDs can increase the risk of GI bleeding, kidney injury, and other side effects. Now let's focus on patient teaching. This is a very important nursing responsibility because many patients take NSAIDs at home. Teach patients to take NSAIDs exactly as directed. They should use the lowest effective dose for the shortest amount of time. That means they should take the smallest amount that works and not continue longer than needed. Teach patients not to take more than one NSAID at the same time. For example, do not take ibuprofen and naproxen together. Teach patients to read labels. Many cold, flu, and pain products may contain NSAIDs. Teach patients to take NSAIDs with food or milk if they have stomach upset. Teach them to avoid or limit alcohol because alcohol can increase the risk of stomach bleeding. Teach them to report signs of GI bleeding. These include black stools, bloody stools, vomiting blood, coffee ground vomit, severe stomach pain, dizziness, or fainting. Teach them to report signs of kidney problems. These include decreased urination, swelling, sudden weight gain, or unusual fatigue. Teach them to report signs of heart problems. These include chest pain, shortness of breath, weakness on one side of the body, slurred speech, or sudden severe headache. Those can be signs of heart attack or stroke and require emergency care. Teach them to report allergic reactions. These include rash, hives, swelling, wheezing, or trouble breathing. Teach them to tell their provider if they have a history of ulcers, kidney disease, heart disease, high blood pressure, asthma, bleeding disorders, or if they take blood thinners. For ketorolac specifically, teach that it is not for long-term pain. It should only be used for a short time as prescribed. Pop test question. Which patient statement shows correct teaching about NSAIDs? A. I can take ibuprofen and naproxen together if my pain is bad. B. I should call my provider if I have black stools or vomit blood. C. NSAIDs have no effect on the stomach. D. Ketorolac is safe to take daily for months. The correct answer is B. Black stools or vomiting blood may indicate GI bleeding and should be reported. Now let's talk about what findings should be reported to the provider. Report signs of GI bleeding. That includes black tarry stools, bright red blood in stool, vomiting blood, coffee ground emesis, severe abdominal pain, dizziness, fainting, or low blood pressure. Report signs of kidney injury. That includes decreased urine output, rising creatinine, swelling, sudden weight gain, or fluid overload. Report signs of cardiovascular problems. That includes chest pain, shortness of breath, sudden weakness, slurred speech, severe headache, or new confusion. Report worsening blood pressure or new edema. Report allergic reactions. That includes rash, hives, facial swelling, wheezing, or difficulty breathing. Report uncontrolled pain or fever. If the NSAID is not helping, the provider may need to reassess the treatment plan. Report if the patient has been receiving ketorolac close to or over the 5-day limit. Report if the patient is taking another NSAID or medication that increases bleeding risk. For example, if the patient has an order for ketorolac but is also taking naproxen from home, that needs to be clarified. Pop test question. A patient receiving ketorolac has coffee ground emesis and feels dizzy. What should the nurse do? A. Give the next dose early. B. Report the finding immediately. C. Tell the patient this is expected. D. Encourage the patient to take naproxen too. The correct answer is B. Coffee ground emesis may indicate GI bleeding and should be reported immediately. Now let's walk through a clinical example. You are caring for a 72-year-old patient admitted for knee pain after a fall. The provider orders ibuprofen as needed for pain. Before giving it, you review the chart. The patient has chronic kidney disease, high blood pressure, and a history of stomach ulcers. The patient also takes aspirin daily. What should you be thinking? This patient has several risk factors. Chronic kidney disease increases risk for NSAID-related kidney injury. High blood pressure may worsen with NSAID use. History of ulcers increases the risk of GI bleeding. Daily aspirin may increase bleeding risk. So in this situation, the nurse should pause, review the order, and consider contacting the provider before giving the medication. This does not mean you independently cancel the medication. It means you use clinical judgment and speak up about safety concerns. A safer option may be considered depending on the patient, such as acetaminophen, topical therapy, or another pain plan, but that decision should be made by the provider. Here is another clinical example. You are caring for a 28-year-old patient after a minor orthopedic procedure. The provider orders ketorolac IV for pain. The patient has normal kidney function, no history of ulcers, no blood thinners, and no known NSAID allergy. The patient receives ketorolac for 24 hours and reports